Hi, everyone. Good evening. Dr. Moosavi and
Dr. Bonnette here.
And thank you again for joining us. Today we are going to proceed with our webinar series of discussions on different treatment pathways that we have for different medical conditions. Today we're going to talk about tendons and tendinopathy, and different ways that we can help that, and different modalities that are used to address the pain that patients have. So I'll just start briefly with kind of what is a tendinopathy, and we're happy to take on any questions afterwards, of course. But so what is a tendinopathy? So tendons are tissues that connect our muscles to our bones. Okay, tendinopathy generally refers to pain and swollen conditions associated with those tendons or those structures in our body. They can develop from overuse as well as an acute injury, and they can become chronic, and they can have impairments on your physical function. And when patients present to us with these types of conditions and symptoms, we look to see what are the best ways to manage it. Number one, we first want to diagnose it. Secondly, we want to see what are the different ways we can eliminate the pain. And we're going to kind of go through some of these different options, but we're going to discuss a little bit more about the pathophysiology of what it means to have a tendon injury. The function of a tendon is, as I mentioned, to connect the muscle to bone. It's between muscle and bone. It allows the muscle to contract, relax, and move. And a big tendon that we probably are fully aware of, most of us is our Achilles tendon, for example, that connects our calf muscle to our heel bone. More often than not, we see many sport-related injuries associated to that specific tendon. And sometimes when you have pain and swelling, specifically, for example, in that area, in the ankle and foot region, that's associated to that tendon region, that we usually call that Achilles tendinopathy. So how does it impact our daily life? Causes interference in our activities, can be painful when we move, can be tender to touch. And so there's different presentations that patients have. It can be very impairing, where you have difficulty walking because of the tendon condition and the pain associated to that. And it can impact your daily life, activities at home, doing daily chores, and work. So there's differences now when we talk about tendinitis and tendinosis. Tendinitis means there's inflammation of the actual tendon, and tendinosis is when that tendon starts degenerating or breaking down. So we want to try our best to try to capture that tendinitis when it presents as an acute inflammatory period. So then it doesn't go into the tendinosis aspect, because eventually what may happen is when we overuse that tendon, we can eventually get further injury and possibly even rupture of the tendon. So we try to catch these conditions early. So when patients come to us, we like to identify it sooner and be a little bit more aggressive with the treatments, because something very simple can develop into something more chronic. Dr. Bonnette, you want to talk about some of the various conditions?
Yeah, I know that. I mean, you initially brought up Achilles tendonitis, which is very common, but some of the other areas that we see tendinopathy or tendinitis issues are in the shoulder, when we're talking about the rotator cuff. We talk a lot about golfers or tennis elbow, which can happen on the inside or the outside of the elbow, along the inside of the wrist, or what's called de Quervain's tendinosis or tendinitis often happens. And in the knee itself, along the patella or the kneecap, where it attaches onto the leg bone there, you can develop tendinitis there. So those are probably the more common tendinopathies that we see in the clinic here. And patients who are at risk of these are, patients over the age of 40, patients who are athletes, who are doing repetitive movements or repetitive duties. So think of someone who's a painter at work, always rolling upwards of overhead movements. patients who are on certain medications or who have certain medical conditions can predispose them to having these type of issues. They tend to be a little less frequently seen than some of the other ones. And unfortunately, females tend to develop these a little more frequently than males. So that is one of the common presenting factors there. And when we talk about how commonly these do happen, we're seeing it in between 2 to 5% of the general population. So 2 to 5% of people walking around on your way to work there are suffering from these type of injuries. So it can affect quite a number of people over time. Yeah, so when we think about how these present, initially there's pain, there can be burning, it can be difficult moving the specific joint, say for the shoulder and the moving above the head there. You can find yourself having some weakness in the joint or area of the body that's impacted here. Sometimes there's swelling, redness, warmth around the skin. All of these things can kind of be seen here. Sometimes we hear popping or you feel popping as you're moving that joint. These are all some of the symptoms that you may experience, but are not the only symptoms, and you don't have to have all of those symptoms, but it definitely kind of plays into the picture of what we're looking at when we're trying to identify these patients. Oh, yeah, and when we talk about what are the exact causes of tendinopathy, it's very difficult in many cases to really pinpoint what the exact moment when this happened. But again, like when I was talking about what type of patients present here, athletes, people who are doing very intense workouts, when patients have imbalances in muscles, say certain muscles are stronger than others, and they're using certain muscles with a heavier load than that muscle can handle. If we're doing improper technique when we're training or doing some sort of repetitive job at work, that can kind of setting your body up for success is an important thing. Lack of flexibility or weakness in the muscle can lead to these issues as well. But yeah, tendon issues don't always happen just with, your high performance athletes out there. 30% of individuals with Achilles tendinopathy or tendon issues are people who aren't the most active patients out there. So it doesn't have to necessarily be, the LeBron James out there who's coming in with this type of injury. Patients who have more of a sedentary lifestyle do actually put themselves at more risk because they're usually not having the same type of flexibility and strength in the muscles. So it can happen to kind of any person out there, depending on the activity that they're doing. Poor blood circulation also plays a big factor, which leads to less nutrients getting to that area of the body, contributing to tendon degeneration.
And I can kind of elaborate more on what Dr. Bonnette mentioned. So we look at some of the day-to-day activities that we can partake in, and us and obviously our patients is basic things like gardening, painting, shoveling, doing things around the house can be very impactful. Patients who are on certain medications, fluoroquinolones, different antibiotics can have these types of conditions develop. Patients who have gout, obese patients, patients who have rheumatoid arthritis, type 2 diabetes. These are very common patients that present with this type of condition. And obviously, I think generally speaking, most athletes across the board are susceptible to this type of injury, depending on what type of sport it is, but obviously they can have this tendon type of related condition. So, how do we diagnose it? Obviously, the biggest thing is location. Where is it coming from? We look to see where the pathology and the pain is. Look at the severity of it. Ask the patient. Does it hurt? How does it hurt? What does it feel like? Is it pain? Is it dull? Is it burning? How long have you had the symptoms? We look for swelling, redness. Sometimes that can be associated with it. We look at range of motion, which is important because sometimes the range of motion becomes limited, especially if the tendonitis is very severe. And in our clinic, we are able to utilize ultrasound to help evaluate the tendon. to see if there is either, just swelling, inflammation, possibly even a tear or damage in that region as well that we can identify. And then if we really want to get really down to identifying the specific pathology, if we're not 100% sure based on our clinical encounter, that we do an MRI, for example. Some more advanced imaging can be done. So treatment is something that presents case to case, and every patient is different. Generally speaking, relative rest, icing can be very helpful acutely at the beginning. Doing some eccentric strengthening exercises involving tightening of your muscles while you hold something heavy, for example, holding it up. Sometimes when we do different types of tendonitis in the elbow, these are the types of exercises that you can do at home and or your therapist can help you with. These things can help strengthen the tendon and stimulate collagen production. Massage, stretching are very common, very important. Heat can also be used at the more chronic phase, just to help keep things loose. And then different vitamins, supplementations, B6, vitamin C, magnesium, etc. Generally speaking, multivitamins can be very helpful across the board. Various treatments, Dr. Bonnette?
Yeah. Usually we start off with more conservative treatments, resting for a period of time after this injury may have occurred, anti-inflammatory medications or over-the-counter medications like that, physical therapy, massage, acupuncture. These type of treatments can be very helpful. Then we start getting into looking at braces that can be used with certain activities or at certain times a day to help alleviate the symptoms. In our clinic, we'll do things like injections of steroid medication, or there's some other types of injections that we can consider. Once we start getting into more advanced treatments, there's things like minimally invasive tenodesis procedures. There's, at the more severe cases, surgical debridement, where you'll have more of an open type surgical procedure to help treat this. But again, we're hoping to catch these at the early phase to help avoid those type of treatments.
So what we're going to do is we have a couple of kind of models here that we're going to show you that after we try physical therapy, conservative management, steroid injections, various more conservative measures, and it still is painful, then we can kind of advance into some of these more advanced treatments. One of which is TenJet, and the other one is called 10X. Both of which are helpful in these modalities as modalities to help with the tendinopathy. And so we have these devices. If you want to start with the TenJet.
This is the TenJet device. Kind of looks like a little wand here. The tip is actually covered here. That's the actually active tip, if you can kind of see it. It's quite small. It looks kind of like a funny looking needle. And essentially the concept behind this is the TenJet device connects this to a specific machine. And you can use this, say, for the elbow into certain tendons here, say for tennis elbow, where you can go in and the tip of the TenJet device will shoot out water at a very high pressure to help debride or remove some of the dead or pathologic tissue of the tendon and help suck some of that out, as well as remove some of the calcifications that can reside within the tendon, and essentially helps clean it out. I like to think about this more as like a power washer for the tendon there. And it can be quite helpful. The device is not necessarily very big. It's very small little poke under the skin. We are able to identify it under ultrasound, be able to treat multiple different areas of the body with this type of device. And the results tend to be quite good. We tend to see quite successful relief with these type of treatments when we do get to that point.
Yeah, and this can be done under local anesthesia. So when we do these procedures, this particular one, it's very well tolerated by the patient. The recovery is fairly straightforward. A little bit of bandaging, etc., that typically comes off after a few days, and the results really can present themselves pretty quickly within a week or so. And again, the idea is to have reduction in pain overall. And here's another kind of intervention that we do is called 10X, which is a little different. This is a slightly different, kind of use of this type of technology, where it's a very similar in structure, where there's a tip and a needle, but this one actually hits the targeted calcified regions as well, like within the bone. Chronically, when we start developing tendonitis, we start getting bony changes as well that may develop into the possibly other areas of pain. So 10X doesn't necessarily use the high pressure water. It actually uses a mechanical interruption of these calcified regions, whether it's the rotator cuff tendon and the calcified bone around it, and or the elbow or any other type of condition. This one, again, it can be done in a local anesthesia. We usually give a little bit of a sedation with this to keep the patient comfortable, but the procedure itself is fairly quick. We can usually do a simple joint in about 10 to 15 minutes, clean it out nicely, take out all those calcified hardened areas. Typically, when this type of condition would present to us, we'd really have not much choice but to send them to, for example, a surgeon for a more open procedure. But this technique allows us to, create another step between us and having the patient go to orthopedic surgery. And obviously, if the need is there, we'll send them to surgery if this doesn't respond to the to what our expectations are. But nonetheless, it can, we've seen very good results with this as well. And so this is a little different, as I mentioned, but these are some of the more advanced procedures that we do. And typically speaking, we again start with an algorithm, and we follow that, and we start with the conservative management, and we develop gradually into some of the more advanced treatment options. So I mean, this is kind of the idea of some of the various ways we can help this type of condition. There are, Dr. Bonnette mentioned, some alternative, injectable methods as well that we usually can offer and discuss with the patient as they come in for consultation. Otherwise, we're happy to take on any questions regarding, any of these types of interventions that we've discussed. And so, any comments?
No, I think that with the spectrum of treatments here, at least in our clinic, say majority of the time we deal with patients who have been dealing with these issues for long periods of time. They've oftentimes seen their primary care doctor, had physical therapy at least once or twice, and have tried a medication, or even maybe have tried a steroid injection. So that's where we try and highlight these other techniques like the 10X and the 10-jet procedure, where that may not be as available at most clinics or most offices. So we can help provide this additional level of treatment, so patients again can avoid more invasive treatments if possible. And yeah, it tends to work out quite well.
Yeah, and regarding some of the more advanced techniques, there's always questions being raised about how long does the procedure take? Is the recovery very prolonged? Is this very invasive? These are all minimally invasive techniques. There really isn't a lot involved with regards to actually getting the procedure done. It's fairly straightforward. We talk to patients through these procedures, and we can have very quick kind of turnaround and recovery from these types of intervention. And a lot of, the question always comes up about insurance coverages, et cetera. Most insurances do cover these types of procedures. Obviously, there's a process involved to get approvals for this. But most insurances are well aware of this type of intervention and how it can benefit our patient when needed. So these are some of the common areas that we see these questions come up to us. Otherwise, typically speaking, when we do the initial consultation, we start with our typical management: physical therapy, range of motion, stretching, sometimes cortisone injections, and then we can graduate into this. Going beyond this, there is shockwave therapy and a few other things that typically can be done. We don't offer these at our clinic per se, but there are patients that bring that up as a question as well. As an adjunct therapy that can be very helpful. to do shockwave therapy, and there are some providers, that do offer that. So, doing a treatment, for example, with cortisone, and then following that with a shockwave therapy can be helpful as well. So, and that we have that. And I don't know if you have any experience with any other kind of techniques that you've used to.
I mean, outside there's a lot of modalities, especially that some of the therapists that we work with can use things like red light therapy, things like different massage type of treatments, different type of even chiropractic type of treatments that can be quite helpful for these conditions. And I think that, just from the different providers that we work with in the area, we're usually able to get people connected with the right person if that's something that they are interested in.
Yeah, and there are certain therapists that actually kind of we found that are good and focused on this type of treatment, because it does take I believe a very aggressive approach to this. Otherwise, we develop from the tendonitis into the kind of the tendinopathy type picture, or tendinosis type picture, where we now developed into something more chronic that can be a little bit more challenging to treat. But it's still treatable, but it can take a little bit more time, more time to treat. But so you try to catch it early. That's why when I see patients, and when Dr. Bonnette and I see patients, and we do the consultations, many a times patients don't realize that it is kind of more of a tendon-related issue rather than a muscle or a joint or even like a spine-related issue. And so we tend then to focus our attention on going through different protocols that we have for more tendon-related matters, so essentially, I mean, there's an easy treatment pathway for it. It can be very helpful for our patients, and we've seen good outcomes with some of these standard of care procedures that we've been offering our patients.
So if you have any type of tendon issue or pain like that we've been talking about, please give us a call. Try and help you out as best we can.
Absolutely. And thank you everyone for joining us. And if there's any additional questions that you have beyond maybe that come up afterwards, we're more than happy to entertain any of these questions. I believe that you may have received some information on the link that you received regarding our clinic, and we're happy to answer them, and maybe even see some of you, so we can chat about some treatment options for you. Okay. All right. Well, thank you. Have a wonderful evening, everyone.